Hello, welcome back everyone. I'm Dr. Henry Aisaboin, and today we will continue our journey through logistics management system in the health sector. In this part 3, we will focus on the practical core of logistics. The practical core of logistics, where we'll be looking at procurement, product selection, forecasting, and quantification. This is where strategic decision making meets real life action. Because if data is the brain of logistics, procurement and forecasting are the hands and the feet, because they move the system forward. Yes, if data is the brain of logistics, ensuring that you have the right data, document your data, then procurement and forecasting are the hands and the feet. They move the system forward. And so we will begin with principles of procurement. Principles of procurement. Under these principles of procurement, we'll be looking at certain key principles, such like transparency, vendor evaluation, cost effectiveness, timely delivery, and compliance. Let's start with the transparency. But before then, I'd like you to know that procurement is the process of acquiring goods and services in a cost-effective, transparent, and timely manner. In healthcare, procurement determines whether facilities get quality products at the right time and price. Without procurement, it will be difficult to be able to determine the quality of the product received or the time and the adequate price for that commodity or product. So procurement is key. It's a department, a section, a unit that ensures that quality and timeliness as well as price is properly taken care of. Now let's look at the key principles that guides good procurement practice. The key principles that guide good procurement practices. Number 1 is transparency. Transparency is the foundation of ethical procurement. All bidding and contract processes must be open and clear to all parties. And why is this so? Because transparency prevents corruption, favoritism, and inflated pricing. For example, when tendering for hospital reagents or equipment, all the potential vendors should have equal access to information and equal opportunity to compete. Number 2, let's look at vendor evaluation. Under vendor evaluation, we need to understand that procurement isn't just about buying. It's about buying from the right people, because vendors should be evaluated based on reliability, based on quality, and their past performance. A vendor that delivers on time with certified products is an asset. One that delivers late or supplies counterfeit goods is a liability to the system. So you must be able to separate of the two types of vendors and hold on to the one that delivers on time and brings certified products, because they are major assets to the logistics management system as a whole. Number 3, cost efficiency. In public health, resources are limited. So we must ensure value for money, that every naira spent yields highest possible benefit. But remember, the cheapest option isn't always the best. What we want is the most cost effective, not merely the least expensive. The most cost effective. It's not about the least expensive. So remember that the cheapest option isn't always the best. Let's look at time delivery. Procurement must ensure supplies arrive when needed. Delays in purchasing vaccines, test kits, or consumables can cripple the entire program. A perfect procurement plan actually aligns delivery schedules with consumption trend. There's an alignment. When you have a perfect procurement, you will find a good alignment of the delivery schedules when those delivery arrive with the trend of consumption. So as people need them, they have arrived already. So that's very clear connection is there. You get there, oh, it just arrived this morning. Fresh, ready, quality. That connection should be there. Delivery schedule with the trend of consumption. We look at the next aspect, which is compliance. Compliance. Procurement must follow national and institutional guidelines, like the government tender laws, donor policies, or WHO procurement rules. Compliance actually ensures legality and it ensures accountability. So when there's any breach, it can result in sanctions or funding withdrawal. So compliance is key, so that guides the whole system, and it reminds us that it could lead to legal issues when there is a breach. You look at the next slide, you will see the steps in procurement. You see the first one, the second one, the third one, and the fourth one. Let's quickly talk about them one by one. So I'll walk you through the basic steps that are involved in procurement cycle. The first aspect is specification development. Here, remember again, as an emphasis, we want to look at the basic steps involved in the procurement cycle. What do we do when we want to procure any material, commodity, drugs, or whatever? What are the steps? Number one, specification development. Clearly define what's needed. What brand do you need? What quality do you need? What quantity do you need? And technical details. For example, specifying the voltage and calibration standards for lab equipment. You want to buy an equipment in the lab, and you did not provide the specification. For example, a spectrophotometer. You have a lot of brand out there with different specification. You have to specify the voltage, calibration standards, that equipment, the aspects that you want to be seen on those, equipment in terms of quality, quantity, technical details. You want to bring everything to the table so that the vendor will understand what you need and be able to go in search of that specific features. Number two is vendor shortlisting and bid solicitation. Vendor shortlisting and bid solicitation. Under this aspect, you want to identify reliable vendors and invite them to submit bids. Remember the word, to identify reliable vendors. You have to. You can't take vendors that are not reliable. Then you invite them to submit bids. Because it will be very dangerous to enlist unreliable vendors, because like I said in the last slide, in part 2, they are liabilities. Unreliable vendors, and they could cause a lot of problem as a result of delay or counterfeit products being supplied. Number 3, bid evaluation. Number 3, bid evaluation. This is where we compare technical and financial proposals, always wanting to balance quality and cost. So we look at what is to be supplied, and then we look at the cost that has been written. Number 4, contracts, awarding, and purchase orders. ORDERS. Contract, awarding, and purchase orders. Once evaluation is done, we have looked at all of them, we have seen and we have struck a balance between quality and cost from all that have been submitted by the vendors. We then award contracts and we do it transparently. You then issue purchase orders that these are the things you should supply. You have won the so and so number of bids worth 6.4 million naira or $6,000. You are to supply this, that, according to the approved specification. And by so and so time, they should all be available and the right quality. Now, I haven't done it transparently. You issue the purchase orders and then you ensure follow-up for adequate and timely delivery. So, you need to remember that good procurement depends on clarity, fairness, evaluation, and compliance. Again, good procurement depends on clarity, fairness, evaluation, and compliance. The 4 legs. These are the 4 legs that keep the process stable, and it is a cycle every time procurement is to be done. So I have just told you about the steps in procurement. Now you can see here product selection. You can see this diagram, demand and supply characteristics, frequency of consumption, nature of use, product characteristics. Under the demand and supply characteristics, you are looking at the standard products, job order products. Under the frequency of consumption, you are looking at fast-moving consumer goods and consumer durable. Under the nature of use, you are looking at consumer goods, individual, industrial goods. And under product characteristics, we are looking at product class, product line, product mix. These are product selection that is carried out. Once we know how to buy, the next question is what to buy. That's where product selection comes in. Product selection ensures that the chosen health commodity actually meets the real needs of the health system. Nothing more, nothing less. It must meet the real needs of the health system. So what are those considerations? Standardization, need assessment, cost consideration, adaptability. Let's quickly look at them one by one. For standardization, it means using uniform products specifications across facilities. You don't use one product here, the same product you now use another brand there. No, it should be a uniform product specification across all facilities. For example, you are getting a glucometer for the wards. You get the same brand for all the wards where they are needed. You don't buy glucophage here, another brand of glucometer there, a stachometer there. No, the same brand across, the same specification across, so that you can streamline your procurement. It helps avoid confusion. It improves compatibility and simplifies maintenance. For instance, having one standard brand of diagnostic test kits across all health centers ensures a consistent quality results and easier training. We want to train the people about how to use the glucometer because it is the same point of care equipment. We can do an online training for all of them at once. We don't have to go and train them on this brand of glucometer there, another brand of glucometer equipment there, another brand. No. The same, and then we can easily train them. This is very, very important. Let's move to the second one, need assessment. Before purchasing, we must ask, do we really need this item? Procurement should be guided by actual demand, disease patterns, and service delivery data. Before you make procurement, do you really need them? There's no point ordering 100 wheelchairs if only 10 are needed. Order the 10 that are needed for the 10 persons who need them. There's no point ordering more because you'll be looking for where to keep them, and it may take a long time. They begin to malfunction because they get rust, damage, no place to store them, no place to proper, and that's a loss for the healthcare system. Number 3, quality assurance. Every product must meet safety and performance standards. Every product must meet safety and performance standards. National, WHO, or ISO approved. The standards can be the national standard, maybe by NAFDAC in Nigeria. It could be by WHO or ISO approved. In healthcare, quality isn't negotiable because lives depend on it. A substandard blood bag or reagent can lead to fatal outcomes during transfusion of the blood to that patient. The next one is cost consideration. We must strike a balance between affordability and functionality. For example, a cheaper reagent may appear to save money, but if it fails to produce accurate results, the cost of errors will be higher. Always consider life cycle cost. That is the total cost from purchase to disposal. You check all that because there's a need to strike a balance between what is affordable and how much it functions. Number 5, we look at adaptability. The products we select must fit the local context, the climate, power supply, and skill level of operators. Buying an advanced machine that requires uninterrupted electricity in a rural clinic is impractical. Oh yes. How can you take an advanced machine and you know this advanced machine cannot afford uninterrupted electricity supply, and then you take it to a rural clinic? That's impractical because you know at the rural, environment, there's no light. So it's important that you take the right decision. Adaptability ensures that the product will work where it is needed most, where it is essentially needed. So you adapt the supply to that place. So You ensure that products align with operational needs and future scalability. Therefore, effective product selection simply means, number one, standardization. Number two, need assessment. 3, quality assurance. 4, cost efficiency. And 5, adaptability. Once you have this in place, then you can effectively select products that needs to be demanded for supply. We look at the next slide. We see the principles of purchasing. You can see the right quality, right quantity, the right price, the right time, the right place, and the right source. We move to slide 9, forecasting and quantification. Forecasting and quantification. This is where your data and decision-making skills as public health professionals come into play. Forecasting is predicting future needs for health commodities based on past data, while quantification is determining how much to procure to meet those needs. Together, they ensure that supplies are always available, but not in excess. Together, they ensure that supplies are always available, but not in excess. At this juncture, we want to see the forecasting techniques: consumption method, service demand method, mobility method. But before we move on, let's discuss a bit on these forecasting techniques. Let's go through these 3 common forecasting approaches used in health logistics, because you need them so that as a logistics manager in the making, you should be able to forecast. And if you must do that, you must know these techniques offhand. Number 1 is the consumption method. This method uses historical usage data to predict future needs. It works well when the health program is stable and data is reliable. For example, if a clinic uses 500 malaria RODT kits per month for the past 6 months, you can project a similar or slightly higher number for the next quarter. Because you see that in the last 6 months or in the last 1 month, we use 500 RODT malaria kits. Now, in the next 6 months, since it was 500 per month, then that would give us about 3,000. Because if we use 500 per month, in the past 6 months, we would have used 3,000 RODT kits. So that way you can project in the future, in the next quarter. If in the last 6 months we use 3,000, we are most likely to use 3,000 or even more than that. Number 2 is the service demand method. This method links supply needs to the volume of services offered. For example, if you expect 1,000 antenatal visits in the next quarter, and each visit requires 1 tetanus injection, you forecast 1,000 doses plus a safety margin. You see that? If you are expecting 1,000 antenatal visits in the next quarter, and you know that each visit requires 1 tetanus injection, so you can forecast that in the next quarter we will need 1,000 doses plus a safety margin in case anything happens. And finally, morbidity method. This approach uses disease prevalence or incidence data to estimate needs. It uses disease prevalence or incidence data to estimate the needs. For instance, if 10% of a population of 20,000 is projected to have malaria, 10% of a population of 20,000 is projected to have malaria, and each patient needs 3 doses of ACT, then you have to forecast 6,000 doses. Because if 10,000 of a population, 10% of a population of 20,000, that will give you 2,000. Because they are projected to have malaria. So 2,000 of them is projected to have malaria. And you know that each patient will need 3 doses of ACT. So 3 times the 2,000. So you need 6,000 doses. You see that? The first method, consumption method, using history. The second one, service demand method. And that uses the link between patient volume and service volumes. And then we have seen the morbidity method. This has to do with disease prevalence or incident data. Let's quickly see the quantification methods. Under the quantification method, we'll look at periodic reviews, safety stock calculation, render quantities. So we will quickly discuss that now. For quantification method, once forecasting is done, we move to quantification. You have forecasted, we need 6,000. Now we have to do the quantification. We move to quantification, turning projections into actual numbers to procure. Now we are forecasted. So how many in actual sense do we need now? Do we need any adjustments to add or to subtract? So to turn these projections into actual numbers that needs to be procured, the following needs to be done. Or you can use the following methods. Number 1, periodic reviews. Here, regular evaluation of stock levels, monthly, quarterly, is important because it ensures accuracy and prevents oversupply or shortage. Regular evaluation of stock levels. Number 2 is safety stock calculation. A safety stock acts as a buffer for emergencies. It's that extra margin that protects against unexpected spikes in demand or delivery delays. It's that extra margin that protects against unexpected spikes in demand or delivery delays. Number 3, we have the reorder quantities. The reorder quantities. This determines how much to order when restocking. It depends on lead time, that is your minimum stock level. It depends on your consumption rate. It depends on your safety stock. Proper quantification avoids last-minute panic purchases. So, reorder quantities is determined by how much to order when you want to restock. So, we have seen the quantification methods. So, let's pause and reflect on what we have covered so far in part 3. You can see the forecasting methods here: qualitative, quantitative. This is an expert's opinion method, consumer survey method. This is also an advanced one. This is quantitative, time series, moving averages, exponential, and all that. This is another advanced method in forecasting. So what have we covered so far? In part 3, We have seen procurement ensures we acquire health goods efficiently, transparently, and cost effectively. We have also seen product selection, that it ensures that what we buy truly meets the health system's needs in quality and context. We have also seen forecasting and quantification to ensure that we plan smartly using data, avoiding both scarcity and waste. So if you get these three areas right, your logistics system will not only be efficient, it will be sustainable. As we close on part 3, I'd like to inform you that we'll be treating part 4 next. And in that part 4, we will discuss commodity security and equipment management. All this referring to the health sector. Take note. And we will look at how to ensure uninterrupted access to essential supplies and to manage healthy facility equipment efficiently. Remember that in logistics, proactive planning today prevents crisis tomorrow. I believe you've enjoyed this lecture, the part 3 of this series in logistic management, health sector. And if you like this video, please do well to like, subscribe. And if you have not been following me, you can follow me at Public Health Lectures on YouTube. And also you can refer to your friends. You can share it with your friends. I believe they have a lot to gain. I'll see you in the next video, part 4, continuation of this series. Thank you. Bye.